So now we're going to continue with the chapter and we're going to talk about the features of we find on bones. And this is on page 130. It is table 6.1 and it has a list of different features and what they are, the names of different features and what they are. And I want you to know where this particular table is because you're going to want to reference back to it when you're doing homework assignments and when you take your test. But you don't have to have this all memorized. You just need to know where this table is so you can refer back to it. But some of the ones I really want you to know are words such as articulation. Articulation is another word for joint. So it's where two bones meet and they move together, provide movement. Muscles cross the gap between two or three bones. So they'll go over a joint to create movement at the joint. Some muscles actually go across more than one joint. That you don't need to have all, know which muscles do that because we're not doing muscles. Muscles would be something you get if you take a full-on anatomy class. Then you have different movements and the terms for them. So flexion, extension, you flex your arm and then you can extend your arm. Another pair of words for movements is pronation and supination. So remember when you're in anatomical position, the hands are down with the palms facing forward. So if you bring your arms up, your palms are going to be facing up. This is called supination. When you look at supination, it's a position that your hands are in where you could literally hold soup. That's how you remember it. So supination. And then if you rotate your wrists to point your palms facing down, that's called pronation. And if you need a little trick for remembering that one, it's supination, I'm holding the soup, and pronation, I pro the soup down on the floor. Your feet do a similar movement, but doesn't go as far because your ankles are not as flexible as your wrists. So if you picture my hand as my foot, then if I turn the bottom of my foot in some, that's called inversion. And if I point it away from the midline, that's called eversion. So inversion, eversion, that's similar to the supination pronation. Protraction and retraction are mostly found with the jaw. If you protract, you're pushing the bone forward, jutting your jaw out, and you retract it back to its normal position. Rotation is the movement of a bone around its axis. That's most easy to see in your forearm. You have two bones in your forearm. The one that goes by your pinky is your ulna, and the one by your thumb is your radius. And when you go from supination to pronation, if you feel your forearm, the ulna doesn't move, but the radius is rotating around on the axis. It's rotating around that ulna. And then circumduction, which is to make a full circle at a joint with a whole bunch of muscles working to make that work. And that's what you can do when you circle your wrist. So the first area that we're going to talk about with the axial skeleton is going to be the skull. There are pictures in your book that you can look at, starting on page 132. There's pictures of a skull, so you can follow along, or you can, if you need more references. So when we look at the skull is actually made up of 22 separate bones with what are called sutures in between them. So the lines in between the separate bones are sutures. Sutures are, again, like the epiphyseal plate, an area that is open in infancy and then fuses later in life as the skull stops growing. Some of the bones are paired. Most of the bones along the midline are going to be singular, at least in adulthood. The first bone we want to talk about is this blue one. This is the frontal bone. This makes up your whole forehead. It's a singular bone. Then we have the two parietal bones, which are the top of your head on either side. That's a paired bone. Then we have the temporal bone, which is this orange one you can see here, which is, called the temporal because it's basically what the part of your head that's called your temple. And then we have the backbone, which is your occipital bone, which is this big brown one. It goes across the back of your skull and all the way down to the base here. Then you have your maxilla, which is the front part of your face where your teeth, your upper teeth are in your maxilla. And you have the zygomatics, which is your zygomatic is your cheekbone. So right across here is your zygomatic bone. You have these two little bones up here, which are your nasals. There's two of them. So the top part of your nose is bone. The bottom part where you can wiggle it is cartilage. So you have the two nasal bones. You have the couple bones that are singular, one of which you can't see at all in this skull because it's down deep enough back into the skull that you can only see it if the skull is disassembled. That's called the ethmoid. There's a picture of it on page 133, and it's a single bone. And the other one that's single is the sphenoid, and the sphenoid is, if I can get this, there we go, open this up, is this red one here. So it's this big butterfly shaped bone that creates the base, one part of the base of your skull. And that one actually goes all the way across, and there's a part of it that shows on the exterior of the skull. So the red right here. So that on either side is your sphenoid. Then you have these two bones called the lacrimals, which are in the eye socket itself. And these are called the lacrimals because they are right underneath your tear ducts. And lacrimal is the scientific word for tears. So those are your lacrimals. You have the vomer, which is this interior bone that runs through the middle of your nasal cavity. You have the palatine, which makes up your hard palate. So you can see the green continues back here. The vomer goes all the way through. And then this up here, this brown, is your palatine bone, which makes up part of your the back of your hard palate, which you can feel if you stick your thumb behind your teeth. There's a hard palate and a soft palate. And the hard palate is formed by a combination of the back of your maxilla and your palatine bone. So when we talk about the bones, we also need to know the names of the sutures between the bones so that we can discuss, how the different bones attach to each other. Let me reassemble my skull here. Before we go the last one I forgot to mention, of course, is the mandible, which is your jawbone where your lower teeth are located. So now we have the main sutures. We're not going to learn the names of every single suture in the skull, but the main ones are, the big one is, remember we talked about that there's the mid-sagittal line when we did our right and left? Well, that's based off of the sagittal suture, which is right here between the two parietals, which runs right along the top of your skull from behind the frontal bone back to your occipital bone. And then where the parietals and the frontal bone connect is the coronal suture. Again, we talked about the coronal plane, that it goes over the top of your head like this, and that's based on this coronal suture that you can see here. Then we have the squamosal suture, which is this big suture between, I'm doing this backwards here, between the parietals and the temporal bone. So this guy right here is your squamosal. And then in the back of the skull, where the parietals meet the occipital bone, is the lambdoidal suture. The other one, which is not present on the skull, is one that we have when we're in fetal development, but it fuses late in fetal development or very early after being born. And that's the metopic suture, which is the frontal bone in development is actually two bones, but that fuses. but it's important to be cognizant of the metopic suture because the there are non-human primates where their metopic suture does not fuse, and it helps to identify and differentiate between different species of primates because of that. When we talk about fetal skulls, I do not have one to show you, but there are pictures in your book of some fetal skulls on pages 134 and 135. Besides having often the metopic suture present, they're going to have what are called fontanelles. Fontanelles are also known as the soft spot, with the most prominent one that almost everybody knows about if they've been around a newborn is this anterior fontanelle, which is right at the juncture of the sagittal and coronal sutures. And it's usually about that big around, and it's an area where the bone has not, the sutures have not closed at all, and it's got cartilage and connective tissue that protects the brain. There's also ones at the sphenoid and back here at this projection, which is called the mastoid process. There's one by the mastoid and one by the sphenoid. And what these are for is in conjunction with the fact the sutures themselves have some give. They do two things. One is when the baby is being born, they allow what's called molding, so that they allow the bones to slide closer together so that the head will fit out of the birth canal. And then the other thing is to allow the bones to grow. Just like the epiphyseal plate, you have to have those cartilage areas where where new bone can form so that the skull can grow. Otherwise, you're going to end up with a grown up with a baby sized head, which is going to be a little on the strange side. So some features can be used to give insight into their birth, gender, and sometimes their racial background. If they're if they have a pure, if you have someone whose ancestry is completely from Africa and you compare their skull to somebody whose ancestry is completely Asian, there are differences because they developed in, and their ancestry, and their genetics developed in very different environments, and they do make some changes in the skull. And you can sometimes make some inferences about male versus female based on some features of the skull as well. So, points on the skull that you need to know different features. The auditory meatus is the bony ear. It's where your inner ear and middle ear are. So it's the bony ear canal. The mastoid process, again, is this bump right here. You can feel the bump actually right behind your ear. That's your mastoid process. The mandibular fossa is the indentation under the skull where your mandible articulates with the skull. And the part of the mandible that goes up there is the mandibular condyle. Excuse me. So the condyle is this part of the mandible here, and it articulates with an indentation in the bottom of your skull, which is the mandibular fossa. So that's the area of articulation for your mandible. This area at the base on the occipital bone, you have these two occipital condyles, which are articular areas for the spine. And they're on either side of this really large hole here. This is called the foramen magnum. So foramen is a scientific term for a hole in the bone. And magnum means really big because this is the biggest foramen in your body. And this is where the spinal cord exits from your brain to go down into your spinal column. So these are the articular condyles for one of your vertebrae, and this is where the spinal cord will exit. And then you have, when we're talking foramen, you also have the mental foramen, which are the ones on your chin. So the chin is called the mental eminence, and you have on either side, you have these mental foramen, and these are where the nerves and blood vessels for your jawbone, for your mandible, enter and exit. And this is part of this is the body of your mandible, and the upright part is called the ramus of the mandible. And then the last thing is that the eye sockets are actually called orbits rather than eye sockets when you're talking about them scientifically. Then the last part we look at in the skull are the teeth. Teeth are very important because the enamel on teeth is very hard and it protects the teeth. And quite often, this can be the only thing that you find of a fossil will be the teeth, because these last longer than any of the bones in the body. They're also important because you can look at teeth and it can give you an idea of what species you're looking at, because there's differences in teeth shape and tooth number between different species. So teeth are very important. In humans, we have two sets of teeth, the deciduous or baby teeth, and then the adult teeth. Deciduous is the same as the term that's used for deciduous trees. It means that you're going to drop them or lose them at some point. Deciduous trees lose their leaves. Deciduous teeth are meant to be, they fall out during childhood. And then they're replaced with 32 adult teeth. So that is 32 is the number for the adult teeth. When we talk about teeth and dental patterns, and we'll talk about these more when we're studying non-human primates, we look at the teeth, we split the mouth up into 4 quadrants. So there's the midline, and then there's the left quadrant and the right quadrant on top, and the same on the bottom. And normally, unless you've had teeth removed or something weird's gone on, each quadrant is going to have the same number of teeth. So we're starting at the midline, you have 2 incisors, 1 canine, 2 premolars, and 3 molars. That's the standard modern human dental pattern. So it's 2 incisors, 1 canine, 2 premolars, 3 molars, 2, 1, 2, 3. When we have teeth individually and we're trying to figure out what we're looking at, you can, look in your own mouth to get a good idea of this. Your incisors are going to be more shaped like the blade of a shovel, or, and then your canines are going to be a little more triangular, a little more pointed generally. Premolars, the other name for premolars is bicuspids, because they have a cusp is a bump on the tooth. So bicuspids, bi means 2, so they have 2 bumps. And then molars have 4 to 5 cusps on them. So you can look at them and you can figure out what you're looking at based on the number of cusps. Below the skull is an interesting bone that's located here in your neck. It's called the hyoid bone. The hyoid bone is the only bone in your entire body without any direct bony articulation. So it's attached by muscles and ligaments to your jaw and to your tongue and to your larynx, but it's not directly attached. It doesn't have any articulation. It doesn't form a joint. But the shape of the hyoid is very important, because they feel that the shape of the hyoid and how it attaches gives an indication as to whether an individual is capable of speech or not. So when you're looking at fossil hominids for, pre-humans, and you're trying to figure out whether they could talk or not, one of the things you want to look at is do they have a hyoid and what's the shape of it? So then we have the vertebral column. And there we go. So the vertebral column, we have different sections that we've split, that the vertebrae are split into based on where they're located and what their function is. And there's a picture on page 141 that shows the different sections of the vertebral column, and there's examples of each of the three. There's 5 different sections, but only 3 of those sections have individual vertebrae. The bottom 2 sections are made up of fused vertebrae. So we have the cervical, which is the neck, the thoracic, which is the chest, and the lumbar, which is the lower back. And those are the 3 sections where the vertebrae are not fused, where we can look at individual vertebrae. All vertebrae have some common features. They all have some amount of a spinous process. This is not a human vertebrae. This is like a cow or a horse. They all have a spinous process. They all have a superior and an inferior articular surface. They all have transverse processes, which are these little sideways pieces that stick out. They all have this vertebral foramen, which is the hole in between the vertebral arch and the vertebral body. And this foramen is where the spinal cord goes through your spinal column, through these foramen. All vertebrae have those things in common. All but 2 also have a good body to them. The top 2 vertebrae in your cervical spine are different than the rest of the vertebrae in your body. So we have 7 cervical vertebrae. All mammals have 7 cervical vertebrae. Whether you're a mouse, a human, or a giraffe, you all have 7. It just depends on what size your vertebrae are. So, top to bottom this way, this is, a humans would be about this big, and giraffes would be, 1.5 to 2 feet, but they still have the same number. So the very top cervical vertebrae is one called the atlas. Atlas holds up the world. The atlas is the vertebrae that articulates with these 2 condyles, your occipital condyles, to hold up the world, to hold up your skull. This is your world, and atlas holds it up. So the atlas does not have a body. It still has the transverse foramen, and it has a very, very tiny spinous process, but it does not have a body because it has to have room not only for the spinal cord, which is first coming out of the skull there, but it also has to have room for the second cervical vertebrae, which is also unique, and it's called the axis. And so it has a small body, very small compared to the other vertebrae, but that body, rather than having a flat articular surface on top, has what's called the dens, and it sticks up and provides an axis of rotation for your skull. So the atlas holds the skull and in such a way as to provide forward and back rotation. And then the axis coming up through the middle provides your side to side rotation. The other thing that all cervical vertebrae, all 7 have, is an only cervical vertebrae, which helps you to know if you're looking at a cervical vertebrae, is what they're called transverse foramen. So besides having this big hole in the middle there, on the transverse processes, and I don't have a cervical vertebrae to show you, but there's pictures in your book, there'll be foramen, holes through both of these transverse processes. And this is because you have these major nerves that come from your head that are called the cranial nerves, and they come down through the vertebrae and they exit into your body through different levels of the cervical vertebrae. And so they have those extra transverse foramen for the nerves to travel out through. And only cervical vertebrae have those. Then the next level down is the thoracic vertebrae. There are 12 thoracic vertebrae. And the thoracic vertebrae are where your ribs attach in the back. And what makes a thoracic vertebrae very easily recognizable is, besides having the superior and inferior articular surfaces, they also have articular surfaces for the ribs. And they'll have one on either side of the body, and they have them articular surfaces on the transverse processes as well. So what happens is, this is the back. This is the posterior. The spinous process goes to the posterior. The body is going to be anterior. Your vertebrae is going to go from the body to the transverse process and then swoop around to the front of your chest. So these are so they have two facets or articular surfaces for support of your ribs before they come around to the front. And that's what makes a thoracic vertebrae easily identifiable. Then the lumbar vertebrae are your largest vertebrae. And within the spinal cord, even within like the thoracic, the top one is always going to be smaller than the bottom one. There's a gradation of increasing size from the top of your spinal column all the way down to the bottom of your lumbar vertebrae. Because we're vertical, we are bipeds, all that weight, all our body weight goes down through the spinal cord. And as you go lower and lower down, they have to be sturdier and sturdier to hold more and more weight the farther down your body that you go. So your cervical vertebrae are your smallest and finest vertebrae, and then your lumbar vertebrae are going to be your sturdiest, biggest vertebrae. And they're going to be sturdier, and they're going to be bigger, and they're not going to have any facets for your ribs, and they're not going to have any foramen in their transverse processes. And that's kind of how you can tell that they are lumbar vertebrae. That's your lower back. Then when you get down to your pelvis, to your pelvic girdle, you have two hip bones that connect in the front at the pubis, and we're going to talk about this in the next class. And in the back, they connect at what's called the sacrum. And the sacrum is 5 vertebrae that have fused together, because you don't want movement. All the rest of your vertebrae allow you to move and twist and turn, but you want your pelvis to be stable, because that's what's holding you upright for when you walk. So your sacrum, the vertebrae are fused to provide stability. And then below the sacrum is a very small area called the coccyx. Coccyx has a variable, like 3 to 5 vertebrae that are fused together, and they are your vestigial tail. So vestigial means it's like leftover in terms of evolution. It's something that your evolutionary ancestors had that you no longer have anymore or need anymore. So we have a vestigial tail because if you go back enough millions and millions of years, we have an evolutionary ancestor who had a full-on tail. But we no longer have it. Somewhere in evolutionary history, our tail was lost, but we still have some of the remaining bones from it, and that's the coccyx. This is not an uncommon thing to see. Some snakes, especially the larger varieties, such as pythons and anacondas, have vestigial legs that you can see their back, some little vestigial legs under the skin next to where their hips would be, because their ancestors were 4-legged. Now, at most, what you see on the outside is just two claws, and that's where their legs would have been. Whales have vestigial leg bones next to their pelvis, underneath where their tail is. So you don't see them on the outside. They don't use them or need them anymore, but they haven't completely disappeared evolutionarily yet. So when we look at the thoracic vertebrae, and we talked about, the ribs are attached to the thoracic vertebrae, but they come around to the front. So what's going on at the front of the chest? So what's going on at the front of the chest is you have what's called your sternum, and that's this bone right in the middle of your chest. And it comes when you're an infant, it's in 3 parts that fuse together. So you have the body of the sternum, which is this main part. Then you have the manubrium, which is this top part that you can feel at the base of your throat. There's a notch, and then it almost makes like a heart shape. And then The xiphoid process, which is this little part at the bottom that, unless you're very skinny, you can't feel, but it's the part that they tell you to be careful not to break when you're doing CPR. So you have 12 ribs, one pair of ribs. You have 12 pairs of ribs, one pair of ribs for each of your thoracic vertebrae. But not all of them attach to your sternum. So you have what are called true ribs, then you have false ribs, and then you have floating ribs. So the first 7 ribs, 1 to 7 from the top down, they articulate directly with your sternum. And so these are the true ribs, the ones that articulate with your sternum. Then 8, 9, and 10 are called the false ribs, because instead of articulating bone to bone with the sternum, they have a cartilage articulation to the rib above them. So, you'll have the rib, and then the next rib down. So you say, okay, these are ribs. This rib would be attached to your sternum. This one would just have cartilage that attaches it to the rib above it. So 8 attaches to 7, 9 attaches to 8, and 10 attaches to 9. And then you have your floating ribs, which are at the bottom. Those 2 ribs don't even make it to the front of your thoracic cavity. They don't even make it to the front of your chest. They are only attached at the vertebrae, and they kind of just float there. Those are the ribs that, when you hear about people getting ribs removed to make themselves skinnier, those would be the ribs that they would remove. So that is where we end today's journey. Next video will be the start of the second half of chapter 6, when we're looking at the appendicular skeleton. You will have a homework assignment every week. This week you have a short extra one just to get enough points in, because we're a late start class, but the extra one's really stupidly easy. So you'll get your homework assignment on Mondays. The videos will be published on Mondays, and homework assignments are due the following Sunday. So you have pretty much a whole week to get your homework done. Again, if you have any questions, please be sure to email me or contact me through the inbox so I can answer them for you. And that's it. I hope you have a good week. Bye.